Good afternoon, everyone. Joined by Director of Public Health, Dr. Mark Veach, Kath Morgan-Wicks, State Health Commander, and the Deputy State Controller, Donna Adams. Look, as I've said many times in this room, the safety of Tasmanians is of the utmost importance. It's been our singular goal since day one to ensure that we can keep people safe and healthy. Unfortunately, the COVID positive man who absconded from hotel quarantine has not been cooperative, leading to inconsistency and non-disclosure of information. Unfortunately, it took 2 days to verify that he was at the Woolies, and with growing concern now that he has had in fact several touch points within the community. We can't continue to wait another 2 days to find out more about what's been going on. Additionally, a further primary contact of the man in the northern suburbs breached home quarantine last night. He has been apprehended and fined, and he's now been placed into a government hotel. Now, prior to reaching our vaccination goals and in readiness to open our borders before Christmas, we simply cannot afford for an outbreak to occur and to put the health and safety of Tasmanians, and especially the health and safety of vulnerable Tasmanians, at risk whilst we get our vaccination rates up. We're at a crucial stage of the vaccination rollout, and with a plan to be open before Christmas and to hit those vaccination rates, we need to ensure that we can continue with that. Therefore, on public health advice, as a result of the circumstances that we now face, there will be a 3-day snap lockdown in southern Tasmania. This will commence at 6 p.m. tonight and be in place for 3 days. It'll end at 6 p.m. on Monday the 18th, subject to public health advice at that time, but obviously we will keep you informed over coming days. The lockdown in southern Tasmania will include the local government areas of the Brighton Council, the Central Highlands Council, the Clarence City Council, Derwent Valley Council, Glamorgan Spring Bay Council, the Glenorchy City Council, Hobart City Council, Ewan Valley, Kingborough, Sorell, Southern Midlands, and the Tasman Council area. Other areas of the state at this stage are not in lockdown. Regardless, I would say please remain vigilant and get tested if you have any cold or flu symptoms, no matter how mild. Also, if you're outside the lockdown region, then please do not travel into the areas that are locked down unless for essential or emergency reasons. From 6 p.m. tonight for the next 3 days, there are only 5 reasons to leave your home. Shopping for essential supplies such as food, beverages, fuel, medicine and health goods within 5 kilometres of your home or closest store. To go out to undertake personal exercise outdoors alone or with members of your household or one other person for safety reasons, once per day for a total of 2 hours only and within a radius of 5 kilometres from your home. You can go out to attend medical or healthcare appointments, including to be tested or vaccinated for COVID. You can go to work if you're a permitted worker in the businesses that will remain open over the course of the 3 days, or you can go to school on Monday if the child of a permitted worker or if the child cannot be supported to learn from home. But otherwise, you'll stay home from school on Monday. Other permitted reasons will be allowed, including, and these are matters that we have learned from past experience, seeking veterinary services for animals, attending childcare, or providing support or care to a personal custody or parenting arrangements. To understand what the snap lockdown means for you, your family or your business, please visit www.coronavirus.tas.gov.au. In terms of gatherings, and I'd encourage people to go to the website to get this information. Indoor and outdoor gatherings are not allowed. There are no more than 10 guests at a funeral, and importantly, no weddings unless for compassionate reasons over the next 3 days, and then only 5 people would be allowed. In terms of visitors to homes, there are no visitors to homes unless they are supporting a vulnerable person, visiting as part of a significant relationship, or visiting as part of a visitor bubble with someone who lives alone and who's not in a significant relationship for support purposes. Regarding business restrictions, there are businesses permitted to open with a COVID safety plan, businesses that can open with restrictions, and businesses that will be closed. And again, the information is on the website, but I'll provide some examples. Cafes, restaurants and hotels can open for takeaway only. However, places such as day spas, beauty parlours, gyms and hairdressers will need to close over the next 3 days. Supermarkets will be open. However, non-permitted retail businesses such as clothing or homeware stores can provide contactless collection and delivery of urgent household supplies only. Construction, both civil, residential and commercial, will be shut for 3 days apart from for emergency needs or repairs. Hardware stores such as Bunnings will be shut apart from allowing tradespeople or those who have an essential or emergency need. Face masks must be worn apart from in your own home and will be required indoors and outdoors for the next 3 days. Visits to aged care and hospitals are restricted, including the number of visitors and visit frequency and length, and again, information is on the website, and Catherine Morgan-Wicks might provide more information there. Regarding travel to Tasmania, Tasmanians who are currently in New South Wales, the ACT and Victoria, noting the challenges that they have and the fact that people would need to quarantine if they arrive here, will not be permitted to return to southern Tasmania during the lockdown period. Returning Tasmanians and other travellers from low-risk locations such as WA, South Australia, Queensland and the Northern Territory who have travel booked to return to Tasmania in the next 3 days, you can return home, but you must enter lockdown and be in lockdown for that period of 3 days. When you arrive, travel directly to your home without making any unnecessary stops and wear a face mask. You must remain at home during the lockdown period where possible, consistent with the lockdown rules. Be prepared to work from home, study from home and only leave the house when absolutely necessary. I want to confirm, however, on Monday, noting that university and some, I think, Year 11 and 12 exams may be taking place, that those exams will be able to take place, but obviously under COVID rules. For non-Tasmanians that want to travel to our state, if you're not a resident, we encourage you to reconsider your travel to southern Tasmania whilst the lockdown is on. For people here who are wanting to leave Tasmania over the next 3 days, please check the jurisdiction where you're going to and make sure that they will accept you. If you decide to leave Tasmania, you must wear a face mask whilst you travel to the airport or seaport, obviously, and travel there as directly as possible without making unnecessary stops. Tasmania Police will be establishing roadblocks and undertaking compliance activities during this period, and penalties will be in place if people are found to be deliberately not complying. In terms of business support, I want to stress to Tasmanians affected by the mandatory stay-at-home orders that there is support available through the $1,500 pandemic leave disaster payment for people who can't earn an income because they must self-isolate, quarantine or care for someone who has COVID. There is also the pandemic isolation grant available, which is $250 per adult, $125 per child, capped at $1,000 per household for those that would normally be working and can't. We will make that available whilst needing to be tested or isolating. For information on those grants, please call 1800 671 738, and obviously we will continue to liaise with business community and anyone else affected as we work our way through this. Now, it's natural that a lot of people are going to have a lot of questions about this. We know this from past experience. If you have access to the internet, I'd encourage you to visit the coronavirus website. And again, I'd make the point, www.coronavirus.tas.gov.au for current detail. We'll continue to provide daily media updates over the 3 days, and if necessary, more regular than daily if need be. You can also call the Public Health Hotline on 1800 671 738 for support and advice. We are upscaling the capacity of the hotline as I speak, but please be aware that they will prioritise calls from those impacted by contact tracing and seeking immediate support. So if you can't get through immediately, please be prepared to call back later if your query isn't urgent. And in conclusion, I'd make this point. We might get to Monday evening at 6 p.m. and we may see no more cases. we may get to Monday evening at 6 p.m. and we may see many more cases. One of the things that we do not want to be in this state is either Sydney or Melbourne, who acted too late in both instances when dealing with Delta. We have a circumstance now where we have a positive Delta case in the south of the state with contacts that we are contact tracking and tracing, but unfortunately the information that we have around those people has been difficult to gauge. We are receiving reports from the public in terms of touch points in the community that individuals may have attended. It is important that at this point in time, as we cannot be certain about the information that we have, that we ensure that we take every step that we possibly can to ensure that the state doesn't have a Delta outbreak of scale that would impact on this community and then on our broader state community before we are in a position that our vaccination rates are much higher. So with that said, I'll hand over to Dr. Veach, who will provide further update.